Hey everyone, welcome to my YouTube channel that is Vlog by Dentist. As people know, we have started the series of MCQs for dental professional exams and like NBDE and FCPS Part 1. And they may help the people with other professional exams related to medical field. So let's start our topic with the first MCQ. That is, which nerve is involved in Ramsay-Hunt syndrome? And the options are trigeminal nerve, abducent nerve, optic nerve, or facial nerve. To understand this MCQ, we need to understand what is Ramsay-Hunt syndrome. So this is the facial presentation of patient with Ramsay-Hunt syndrome. As you can see, the main symptom is facial paralysis. And whenever there is facial paralysis, we consider some degree of facial nerve damage depending on the type and extent of facial paralysis. As we all know that facial muscles are supplied by facial nerve. So this is easily acceptable that whenever there is facial paralysis, there is some degree of facial nerve damage associated with it. So as we know, the main symptom of Ramsay-Hunt syndrome is facial paralysis. So we can easily say that there is some degree of facial nerve damage associated with Ramsay-Hunt syndrome. So we can say that nerve involved in Ramsay-Hunt syndrome is facial nerve. Going towards the second MCQ is regarding mastoid process, which one is correct? There will be certain options that we need to understand or clear that they are correct either or not correct. So on the basis of this, we will decide the answer of this MCQ. The first option is that mastoid process development depends entirely on sternocleidomastoid muscle. The second option is at birth, mastoid process is underdeveloped and it grows after birth and assumes a nipple-like form at about second year of life. Third option is towards puberty. Its spongy internal substance becomes permeated with air spaces known as mastoid air cells. And the fourth option is that splenius capitis muscle attached to the lateral surface of mastoid process. And the fifth option is that all of the above options are correct. Now we have to decide which one options are correct, and on the basis of this we will decide the answer of this MCQ. So the first option is that development depends entirely on sternocleidomastoid muscle. As the name indicates, the sternocleidomastoid muscle, its attachment on one side is to the mastoid process. And we also know the concept. There is a concept of growth that is called as functional matrix concept, that whenever there is functional demand on the muscle, it will stimulate the growth in associated structures. So whenever the person has a functional demand on this muscle, that is sternocleidomastoid muscle, this is sternocleidomastoid muscle, it will affect the mastoid process and will cause its growth. Depending on the functional demand of sternocleidomastoid muscle, we can say that the mastoid process grow. So the statement that is the development of mastoid process depend entirely on sternocleidomastoid muscle is totally correct, because on the basis of functional matrix concept of growth. So the first option, that was development depends entirely on sternocleidomastoid muscle, is correct. Now we will move to the second option and see if it is correct or not. The second option is at birth, mastoid process is underdeveloped and it grows after birth and assumes a nipple-like form at about second year of life. There we can see the skull of almost 2 years old, and here we can see the skull of like an adult. Here this is the mastoid process in the skull of 2 years old, and this is the mastoid process in the skull of an adult. There we can see that mastoid process is like a nipple-like form, and it is almost a 2 years age. And there we can see a prominent mastoid process that is almost growed. So the second option, that is at birth, mastoid process is underdeveloped and it grows after birth, assumes a nipple-like form at about second year of life and grows later, is totally correct, as we can see there in the diagram. Going towards the third option, that towards puberty, its spongy internal substance become permeated with air spaces known as mastoid air sac. This is the texture of bone at almost 2 years of age, and this is the texture of bone of mastoid process at almost of adult. Here we can see the substance of mastoid process is spongy internal substance, but when it comes to puberty, this spongy air substance become permeated with these air spaces, and these air spaces are known as mastoid air cells. So the third option of this MCQ is also correct, that is, at puberty the spongy internal substance of mastoid process become permeated with air spaces known as mastoid air cell. Here you can see the clear difference between the structure of the mastoid bone in the young patient and in the adult patient or at the puberty. So we can say that this option is also correct. The fourth option about of this MCQ is the splenius capitis muscle is attached on its lateral surface. This is the diagrammatic representation of splenius capitis muscle, and here we can clearly see that it is attached to mastoid process. So we can say that this option is also correct because splenius capitis muscle is attached to the lateral surface of mastoid process. So we can say the right answer for this MCQ is answer number 5, because all of these options are correct. As we have seen there, that development of mastoid process depends entirely on sternocleidomastoid muscle. At birth, mastoid process is underdeveloped and it grows after birth and assumes a nipple-like form at about second year of life and grows later. Towards puberty, the spongy internal substance of mastoid process becomes permeated with air spaces known as mastoid air cells, and splenius capitis muscle is attached to its lateral surface. All of these options are correct, so the option number 5, that all of the options are correct, is right answer. Going towards our third MCQ, that is, if tip of tongue is dissected, which taste cannot be perceived by patient in such case? The options are salty taste, sour taste, sweet taste, and bitter taste. For this to understand, we need to understand which part of tongue tastes which type of taste. So here we can see that sweet taste is sensed by the tip of tongue. Salty taste is sensed by the anterior and lateral regions of tongue. Sour taste is sensed by the lateral sides of tongue. Bitter taste is sensed by the posterior third of tongue. And umami taste is sensed by the anterior two-thirds of tongue. Here we can see is the difference between which taste is sensed at which location of tongue. So if the tip of tongue is dissected, sweet taste, patient will not able to sense sweet taste because it is only sensed at the interior part of tongue or tip of tongue. But he will be able to sense the salty taste because it is also sensed by lateral sides of tongue, and he will also be able to sense the sour taste as it is sensed by lateral sides of tongue. Bitter taste because it is sensed by posterior one-third of tongue, and umami taste because it is sensed by interior two-third of tongue. So all of these tastes will be patient will be able to sense except the sweet taste, because the sweet taste is sensed by interior and tip of the tongue. So we can say the right option for this MCQ is that if the tip of tongue is dissected, patient will not be able to perceive the sweet taste. Thanks so much for watching. Don't forget to like, share, subscribe, and comment, and suggest us the topic so that we can make video for you.